Well, you guys, welcome back to Breaking Generational Curses. We have a special guest with us today by the name of Dr. Cierra Roach. She works in pediatrics, and we're going to discuss Black health. So, again, you guys just know that help is on the way.
So I'm just gonna jump in, y'all. So what do y'all feel like are some hesitations that Black people have when it comes to seeking treatment? What do y'all feel like is kind of going on?
So I would say one of the biggest things that I see in the medical field is probably history. That people have seen kind of how Tuskegee, how even at John Hopkins now there's some controversy over one of those trials they just did, and there's just a lot of history of how blacks and a lot of minorities kind of get treated in the field of medicine, and I think that has just continued to bring on the distrust between physician and providers and different patients. So that's the biggest thing I would say I see.
And I agree. This is particularly true because of now with what's going on with the whole COVID and getting the vaccine and everything. A lot of us are hesitant to getting the vaccine for fear that we may be getting injected with something else aside from the vaccine. So,
And I know, like historically, the fear is warranted. The mistrust is warranted. Going back to slavery days, where Black bodies were used and experimented on, all the time, especially like in the fields of gynecology and obstetrics. You go, you pop out your baby and get back in the field. Or even like a lot of the reproductive surgeries and stuff were done on Black bodies. Like it's one individual in particular who she had over 30 procedures performed on her. So I think that the trauma associated with being in that historical context trickles down, to where we tend to not trust medical people at all. We're not sure if they have our best interest at heart and things like that. And so I see that as a big barrier that needs to be overcame by the healthcare system and the doctors and people in it.
mm-hmm.
And I think even kind of we discussed even coming into the dialogue, Dr. Roach, you mentioned that it's only 7% Black in the field, and so even just hearing that, like I know that there is a disparity, but 7% is such a huge number. So thinking about how do you feel like you were trained to even have that awareness about how to interact with Black people, or just even noticing or combating that fear when you came into that and into the room with them? Did you ever have that kind of discussion with anybody in your when you were studying?
Yeah, I actually had a good mentor, Dr. Savage. And I went to ECU. So I'm born and raised in Greenville, North Carolina. So I was actually at home. Yep, 252. So I was actually born and raised there. So I kind of already saw, especially the racial connotations that you would see. So I already kind of knew what was going on. And I had people in my corner that I actually knew from there, but I could see how um, if you went to a residency or a medical school away from home, it's a whole new change. Like you're not going to have people there in your corner, and there are a lot of unfortunately we have to do that, but there are a lot of like Black doctor groups and stuff like that to be there to mentor so that you're not the only Black person in your facility. You have somebody that can have your back because other people may not. And so unfortunately it's something that hasn't, there's curriculums, people are trying to be more diverse and, we're seeing an increase in the population. Like you're seeing, hey, Harvard just had the first Black, whatever, pediatric surgeon. I'm just making up stuff, but they had a whole bunch of firsts recently, but it's still a lot. Like we're in 2021, we shouldn't still be having the first Black this person and that. So medicine has come a long way, but it has a lot more to do.
I mean,
Mm-hmm.
it's
That's
a
true.
evolutionary conversation and process, that we are in, and I think especially having this dialogue today, right here, right now, is part of that process, part of that evolution, part of getting people more aware, and get people more connected, because health is important. That's one of the things that we don't take care of as best as we should at all. And yeah, there are structural, a lot of structural things that influence our health, but also our own decisions and our own attitudes and beliefs and things like that. So I just feel like when it comes to like addressing these, we first need to start talking about them. And I feel like that's what we're doing today.
I like that. So in talking about that, I really like the idea of just starting that. And so with the starting the conversation helps release some of the stigma around the physical health, going to see a physician, going to see a mental health practitioner, anything, going to reach out to anybody. So Dr. Roach, how do you feel like you have had to deal with the stigma of people reaching out for coming to medical facilities, or just even in the room with somebody? What do you feel like you're kind of dealing, walking up against when you're working with somebody?
To me, I always approach it as you kind of have to relate to people. So you have to kind of feel them out, see where their views are. If you go in this kind of paternalistic view of, okay, I have this background, you should do this, and this, you're not gonna get anywhere. So you have to actually see where people are coming from. So even with vaccines, so in pediatrics, we see a lot of people that are against vaccines before even COVID. We would see a lot of anti-vaccine population, which is why we're seeing more measles, mumps, all that stuff coming back. But you have to kind of talk to them. So kind of how my guidance is kind of see, okay, so teach me where did you get your information from? Because a lot of times it's just misinformation that's out there. And so once you actually spend the time and people see that you care and you actually talk to them on a one-on-one level, you really break those barriers. So I think you guys probably have all seen that in just day to day, like just breaking those barriers. Like we're seeing that just with, Black Lives Matter movement, like all these movements, we're just seeing like a lot of stuff just starts with just a conversation. And I think that's the first part. And the public health field is definitely going in that way where, you have to get back down to the individual level, to the community level. You can't just address it. Hey, let's go into this community and let's fix your problems. That's not going to address anything. You got to really get down to the level of what's really going on.
Yeah.
Okay.
I want to run back to something though.
Yes.
When you just said,
Oh, what I
when you
say?
said, teach me them some words, that's an approach right there.
Okay.
I freaking love it.
Yep.
Like,
Yep.
connecting with that person, as a human being,
Mhm.
not coming in as that, oh, I'm the authority, I know everything. No, teach me. I love that. That is freaking phenomenal.
Yeah. Seriously, it's such like it's such a switch from what I'm sure you probably learned. Me, I know for sure I learned you're coming in with somebody like from the mental health, but just coming in the mental health field. Most of our training has come from like older European white males, and so everything in the way that they see that we're supposed to interact with somebody is coming into your community. Like, I'm coming to save you, I'm coming to help you. You're a barbarian. Let me teach you skills and learn nothing. Even like I love what Cassandra said like a couple episodes ago, was talking about the wisdom sharing. And so the way that the field of medical, mental health, all of this right now is structured is for us to come in and we are the authority on people's lives instead of giving them that. So I really love that that is your approach coming in, because of course it seems obvious to us, but most of the time people come in and don't ask you a question about anything about your history, to know anything about anything. Just, hey, this is your presenting issue, and I'm going to tell you what to do without learning any of that. So I really love that you said that, because that is definitely a switch that the medical model and so many other people could probably, benefit from. So, with thinking about the experiences working with Black women, how do you see that show up, especially about preventative care, and maybe even how that ties into how they preventative care for their children?
So I think a big component, and I could be biased, is I think actually going to a clinic and them actually seeing a person of the same race as them makes a big difference in them, actually getting their preventative care. So I feel like that always makes a difference. And my population here is heavy Medicaid. And so we have a lot of minorities in our clinic. And we have one lady that is Spanish speaking, so she takes most of the Spanish patients. But I just see the joy because I'm the new pediatrician on the block. So I've only been here like 10 months in this practice. And just the relief that they see in their face when you come in, and they're like, oh, it's one of us. Like, oh, she got crochets in. Like, oh, good. And that's just that one bond that you can really break. I'm not saying you can't have it with other races, because you can. It just depends on how you are personally. But I think that's one thing. Like, I don't think we're ever gonna, like, 7%, like we were talking about, 7% of the whole medical population is African American. We're not gonna. That's not how the proportion of American is built up. So we're not gonna tackle it with just the 7%. Like, we got to address it from the forefront. We got to have more African American physicians in there, to be able to relate. And so I really think that's gonna make a change. Like, little things are great, but that's gonna make a big impact and a big change. Um, I honestly would say it's exposure. Like, I don't think, like, I'm the first physician in my family. I can't speak for everybody on the panel, but a lot of times, you may be the first college graduate, you may be the first, whatever in your family. And if you don't see it in your family, like, I'll pick on Bill Gates, like, all his kids, like, done see him make millions and millions and millions. So of course they just, they're sitting on money, like, they're good no matter what career they do. Or if you have 8 physicians in your family, you grew up in a doctor's office. So if we're not exposed to that, we don't see it. It's hard to imagine. So that's why I've kind of come up. Like, I'm big on mentoring. It's why I came up with the CC Ball equations. And that was to kind of help provide a guide. I've seen what struggles I've had throughout my career, and it's just a guide for people. Like, all right, so here's how you can be what you want to be. And so I love going to health fairs. I still like being in the community. I like, you guys see, I'm here today on a Sunday. Like, I still like being, involved, because I feel like that's like where you make the difference.
That's true.
I love that.
Thank you for that. I commend you for that. I think it is like more so like she said, the exposure and education, like educating the community on it. Because I grew up in a household where my grandma would say, "Girl, drink you some Robitussin, and the bed ain't on it. You ain't going to the hospital." So I kind of adopted that too, to where I would have to be darn near dying before I would go and see a doctor, knowing I'm in pain. So a lot of that is education and it's exposure. And two, about the education piece, I'm now more open to going to a doctor, or more open to seeking help from a counselor, or going to see a therapist or whatever. But in my household growing up, we didn't have that. It wasn't possible. It was looked down upon if you try to get a therapist or try to go seek medical help or whatever. Like we spoke about in past episodes, we talked about it being, you consider weak for doing that or whatever. But if they was educated on the fact that if you need help, seek it, then it'll change the narrative of everything. And I now shop for a Black doctor on purpose, and I hate that the fact that although I'm in Atlanta where all these African American people are, I live in rural Georgia, where all I see are white doctors now. So I guess you can say I have to settle for now a female doctor, someone who I can relate to more so than not. So, but I shop for a Black doctor on purpose, a Black female doctor on purpose, and if I can't find one, then I have to settle for a white
grandmas, they raised us, they told us all this and that, but to be honest, like, even at ECU, it wasn't Biden then, Pitt County Memorial, you couldn't go to that hospital until like the 60s, 70s. So, like, your grandparents, that was the way of medicine. There was no other, all the places didn't have a Mehere where they had a Black only hospital and stuff. So so some of that is, that's how they were raised, because there wasn't anywhere to go. But then also knowing that we have to educate and say, hey, we do need to go to the doctor. We do need, to do certain things as well. So it's a mix, and it's hard sometimes, because I hear from my grandma too. I'm a whole pediatrician. Girl, you better do this. They need to put rice cereal in that formula at 2 days old. And so all of it, there's good and bad to it.
Yeah, and I think that too, that ties in with that generational component, to where you have these kind of values or experiences that lead to these type of decisions, like not going to a doctor unless something's just absolutely fucking wrong. And by then it's
Yeah.
usually wrong.
Right.
Like to where
Too
like
late.
multiple epic fails physically.
Yeah.
But instead of like taking that preventative action, like and it's just so commonplace these days, and a lot of it is like why we the black community has as many health problems as they do. It's not, of course, not the only reason. Multiple complex factors involved.
Mhm.
But when you're not focused on that preventative care, that's a lot. Like especially with the high rates of like heart disease and high blood pressure and like conditions that you can actually either prevent or you can alleviate in severity, things like that. And not doing those preventative measures is a big issue with that. But
Mhm.
also too, thinking back to generational stuff, and of course, I know in the mental health field, I've always hated this particular
Mhm.
comment. Pray about it.
Mhm. Oh yeah.
So,
Yeah.
oh you sick? Oh they're about to die. Pray about it. Instead of actually going to get care. So I just wanted to just point that out, just the generational trickle down of how those cycles can continue on until we break them.
Yeah. That's true.
Mhm. I really like both of y'all bringing into that historical context of it, because honestly, I probably wouldn't have thought. I understand like, oh, grandma didn't want us to go to the hospital, but I also probably would have never thought about the concept like grandma didn't have a hospital to go to, so of course we
Yep.
had to do
I did think about
healing and things like that at home. Because I kind of think back, I might think about, oh, in slavery nobody was caring about your body and doing like that, but even as we got into more modern times in the 60s and 70s, like literally that's our like parents' age, right? Like they couldn't even go into the hospital. So that was something that even that added on to make me think
that.
about
Mhm.
it. That is why they also couldn't care about their physical health, dental
Mhm.
care, mental health, whatever it is, because they didn't just truly didn't even have access to it. And I think a lot
Right.
of people take that for because I always had black doctors. My mom worked for a medical school. I've literally always had black doctors, always, and I took that for granted because that's just what my world is. I'm in Atlanta. It's black people. My mom worked at a black medical school. I knew what a black. Now you think about that, because sometimes even when I travel outside of Atlanta, I have to take it to think like, oh, they might be used to black people caring about these things or having access to these things here, but once we step outside of it, it looks a lot different. So that was
Mhm.
like a good eye opener and a reminder for me as well.
Yep.
Uh-huh.
So, in going back to what Dr. Roach said in regards to our parents and grandparents not having the hospital to go to or doctor to see, how will we now help them realize that now you do have a doctor now, and how do we get them past that whole being afraid to now being comfortable with going to see a physician or see a doctor? Because a lot of parents or a lot of old people who I do notice will not go. They can have all the symptoms in the world of diabetes, have diabetes, but they will not go see a doctor. And now is, how do we get them to now feel comfortable with going to see a doctor? That question is for anyone.
So I'd say first you have to, for one, they have to come, they have to, one, have insurance.
Mm-hmm.
Unfortunately, in that time, we have to talk about insurance, even though we're in America, you think we'd all have insurance, everybody has, but it's not like that. But two, finding somebody that you can just trust in the community. So, asking somebody else who they see and just getting referrals. Um, but actually, and if you realize that, you and your doctor, like, used to be people would stay with the same doctor 40, 50 years, which is great. But if a few visits that, they're not providing the care you need, the relationship isn't working, it's okay to shop around. I don't say you hop around like you change your underwear, but
Mm-hmm.
um, it's okay to hop around and, figure out who's the best fit for you.
Yeah.
So don't feel like, you're stuck with this one provider. Um, this is the only doctor in the whole town. But just finding somebody that kind of fits with you. And Google's out there, so look people up, see what their interests are, see where they went to school, see what their training is, see what their passions are. We have the capabilities. You don't have to go to the library and go to encyclopedia and find stuff like you had to before. So
Yeah, that's true. And I think too, they have to be open to being enlightened. Sometimes they just be stuck
sure.
in their ways. They're like, I'm not listening to you. But I think too that's another component. It has to be open to getting the knowledge of finding a doctor.
Yeah, that's true.
It also makes me think about acknowledging people's fear behind it. I know in the mental health field, people are always so scared about what I don't know what they assume is going to happen in counseling, or if they're going to uncover something, or they don't want to tell people their business, or whatever the aspect is. But I think just really acknowledging people's fear, like Dr. Roach did, bringing up like we understand that there's a historical context for you to be untrusting. I understand that there are systems in place for you to make you untrusting, and so truly acknowledging those things at the forefront instead of just saying, oh, it's not a big deal, just try it. So just really, really acknowledging, like, I get that there's fear. I understand that this is the unknown. I understand that. And, maybe exploring, like you said, talking to different people in the community. Who are you seeing? Who are you going to? And then really talking to whoever your practitioner is. Like if they feel like they are not a good fit, if they feel like trash, or they're going to talk to you in a certain way, then decide to move on. I know a lot of times when I go to physicians or people in other parts of my community, a lot of their physicians are fat phobic, and so that makes them very scared of just going in and saying, hey, I have a lump on my shoulder, because they're fearful of what that's going to turn into. So being able to reach out in whatever aspect, beyond that, to see who can care for you the way you deserve to be cared for, and then remembering that you deserve care, and not because whoever they are, it doesn't matter who they are to you. They're another person trying to help another person. If they don't see it that way, then find somebody else, and that's okay.
Mm-hmm.
And everybody should know that they deserve to have health care. No matter
Mm-hmm.
what our government says, no matter where we are in society, like everybody deserves. I wish
Yep.
we were in some other country sometime that everybody had access, but
Yep.
unfortunately we aren't. But
Anybody else have any other questions that we want to add into, or maybe follow up on what we can do to help people kind of deal with the stigma for reaching out for their health?
I would say there are an empowerment component. um, like yes, there are so many different stigmas and stuff when it comes to seeking medical care. There's also different barriers when it comes to having access to that care as well. But ultimately, education and encouragement and empowerment, I think, are some things worthy of being explored when it on a community level, if that makes sense. Just because we have let this go on for so long, and Black people do have absolutely horrible rates of health disparities. So I think just going forward, like what we can do, and that's regardless of what your job is. I don't care if you work at Walmart or work at Publix or whatever. But just like taking a moment to focus on your health and well-being, and what do you need at this point in time, and how can you help empower others to make those decisions for themselves at the same time as well. Now I say that I'm not perfect when it comes to getting my own preventive care, um, but I do know that by focusing on my care and my health, it will overall help my own quality of life. And that's one thing that I can control. So like I have herbal supplements that I take. I make sure I get my fruits and my vegetables in every day. Like I will go in on some oranges. That's been my thing lately. Oranges and apples. But just like because there's so many variables involved with the medical system, I see it as a way of me, what can I do for myself to help my health type of thing. And so that's what I look into doing. So just kind of looking at my food, my exercise level, activity level, and things like that, especially this day and age where we're so sedentary, that we're just always sitting and looking at the computer, or working on the computer, or sitting at a job at the computer. So yeah, like when it comes to health and healthcare access, those are things that we need to take care of, but also focus on what you can do for yourself.
So, Dr. Roach, I'm one in particular, full transparency, where I have been adamant about having a child at my house. It is not because of it's cute to give birth at the house, but it's because I am really fearful of the doctors and really fearful of hospitals. And I really feel like my house is somewhere where I have control of what I would be exposed to in regards to what I'm exposed to at the hospital, at the doctors, in regards to giving birth to a baby. So what are your thoughts on that? And before I let you start, I'm sorry to me cut you off before you start, but I'm the only one I think in my family. Sorry about that. In my family who has thought about giving birth at the house. Everyone else has always given birth at the hospital. So I don't know if where the generational aspect come in at, because I'm not continuing to do a trend that my family has done before me. So what would be your thoughts on that?
So I have a lot of hats for that one. So I have the pediatrician side, just the medical side, and I want to be a mom too. So I ain't settled down yet. I hope to get married soon and have kids, but it's scary. So unfortunately, the maternal death rate for African Americans, and I'm in an MPH program, is like 25, 30, I think it may be close to 37% in America, which is crazy. As the national, I shouldn't say national, world rate is like 19% or something like that. So I mean, people still die from childbirth. Childbirth is nothing easy. It still can, you can have PEs, you can have anything during childbirth. So that's still very traumatic. But the maternal for African American is extremely high. And a lot of it is featured in the South. So like basically Virginia, North Carolina, down all the way, Mississippi, Alabama, and then kind of Arkansas, Texas is where it kind of ends. So pretty much the South is where the high population of it is. So it's scary. So even me in the medical field, giving birth from my own hospital is scary because there's plenty of studies to show how African Americans aren't treated for pain as aggressively. There's plenty to show that they're not taken, as seriously. They'll continue to go back, which is, you've all even seen this in COVID. You'll keep going back and back and back. And they keep saying, oh, nothing wrong, and then they're close to death. So the same thing happens kind of in childbirth. So it's very, very scary. I wish I had something to reassure, but I don't. As far as that, and as far as the pediatric side, the hospital is a safe place. And I do believe in, hospital birth. Can you have a home birth totally normal, with no issues, and be safe? Yes, I would make sure you go through like a certified midwife or something like that. And if you decide to do it at the birthing center, look at their ratings and stuff like that. They're closed down now, but there was one in Cary a few years ago. We used to have a lot from Womack, and they had like 5 deaths of babies in like a year. So just be careful where you go. A lot of those places are trying to make money, so just kind of do your research and be careful. But you can actually do home births in a lot of hospitals too. I shouldn't say home births, water births in hospitals. So they have units where you can do like your water birth just like you were at home, and it's not like in a hospital bed and stuff too. So just knowing those resources out there, but the fear is out there. I wish I had something that reassures, but I don't. I didn't even know that literature was that bad until this last semester in my classes. But it is truly out there. And it's even higher in like Alabama, Mississippi. Those rates are even higher. And unfortunately, we don't necessarily have a solution for it. I think it all comes back to what we've been talking about, race and stuff like that. But I mean, there ain't nothing in the book that's going to tell you that, but I think that's what it comes down to. Most of your docs are going to be white and your African American culture, and then they just have a high mortality, whether they don't care, whether they just don't treat them correctly, whatever happens. But it's unfortunately a big problem in America.
Yeah, that's true. Very
Sorry,
much
that's
so.
a long answer to that one question, but it was.
But hey, you made it clear for me.
Right, and it's really a complex issue. So it's really not a single answer or anything like that that can make it magically shift. So,
Yeah.
but those
Yeah.
are some very valid points to make, and it's understandable to have those fears. Me personally, I don't like hospitals like that.
Yeah.
At all. Now, when it comes to like childbirth and stuff, I haven't considered such things at all. Not at all. But
I just
would
started this
say,
year.
But
Baby
since we're
step, baby
since
step.
we're on the subject, I'll ponder a brief moment. But I think I would be one of those people who would do a midwife as well. Just to have that kind of like that deeper relationship with someone throughout the process of me gestating. I would go that route, and I think that's um part of it is kind of just like me liking those type of relationships, and I would need that type of hand holding versus just the you show up to the hospital with the appointment, that's it. I'm gonna need some hand holding. I'm gonna need some encouragement. I'm gonna need some support. I'm gonna need someone who's gonna be willing to educate me on what's going on in my body, on what I can expect, because I like to know these things help me cope with life. And so yeah, like, so in that sense, I would, like I said, I'm briefly thinking about this. I'm not trying to manifest shit, but that would be my thing. Not that I'm anti-kids. I'm just not trying to manifest that in my life right now. But once again, this is an important discussion to have in these situations, because like Dr. Rush said, there's so many different factors that affect both maternal mortality and infant mortality rates, and a lot of that is race-based assumptions and stigmas that date back for hundreds of years. And so by having that awareness of these things, you can better know how to interact with these systems to where you can make sure that you're getting the best care possible. So like some people, they take that, oh, well, damned if we do, damned if we don't type thing. No, it's important to know all even all the bad stuff or less ideal things, so you can make better, more informed decisions for you, your family, your child, whatever. Starting with the conversation.
I wonder if you go back to just slavery time, like blacks were like, meant to have kids. They were meant to reproduce, bring more to the farm. They actually even, some of the owners would sleep with them and have more kids to produce to it. And I mean, I can't say we have written literature from back then, but I wonder I bet you they were not dying like they are at a rate right now. Which means race comes into a factor.
Yeah, that's true. Didn't think about that.
Yeah. I like that. Even if they were dying, it could tie into them dying at some type of rate, because they only cared about the production of them. Like, oh, well, we don't want her to die.
Too many girls are coming, too many boys.
Right. I know I was reading something. It was definitely historical fiction, but they talked about the idea of somebody being just like a breeder. So we only have them here to breed, like Dr. Roach said. So like we needed her to do good. She's a good breeder, so we cared about her. And then they said, oh, some of them can't be viable. They can't do that, so they didn't care. And so they did very minimum to just care, like, oh, let's keep her alive. She's near death, but she's not dead. So let's do that enough to just keep her alive so she can produce, because she produces good things. So
it might not be all fiction, because there's plenty of literature in like lactation and stuff. Like black women actually produce, even though I don't know why the stigma has changed and we don't breastfeed as much, but we actually produce a lot of breast milk. We actually used to feed everybody in the household.
Exactly. So that's so many aspects tied into our health, because we try to ignore these racial aspects of things, because we've lived in a society really up until recently where we're able to really say these things out loud and call a thing. And so now it's very interesting to just say, hey, there is some disparities that are moving beyond just like, oh, it's let's not talk about it. We don't want to talk about Black health, or we don't want to use Blackness around it. Why does it have to be about races? But we see that if we really tap into our historical context, that there's a big reason why why this is happening. This is why Black research needs to be happening. This is why Black people need to be getting into these professions, because at the end of the day, we can pretend that we don't want to buy into certain things about systems, but who is going to be there to care for us when we do have to have access to some of these things? So I think that is something we have to keep in mind, where it is if you're going into working into hospitals or being in these systems or even navigating them as a student, what does that even look like? But we do need somebody to go in and break those barriers, because what else will be there? If we don't show up with this type of mindset, who else is going to be there on the other side for us?
Right.
Yeah, the important representation.
And there's a book by Harriet Washington called Medical Apartheid.
Mm.
And then this book is freaking phenomenal. Number one, recommended read. And yes, some of the parts will get kind of gruesome. So, but that's life. Like these are truths, facts, and realities. I was gonna try to show it in my thingy. It's not working because my blur. Take my blur off. But like this, in this particular book though, it really goes into the history of all these things and how they come about. So there's medical apartheid. But she goes into like so deeply into the historical context, and it's not just her writing about like she did her research. She went through like old hundreds of years old medical journals. Um, she's interviewed people. Like she goes really in depth about the different historical aspects that led us to where we are today, and so even when it does come to the medical care piece, like yeah, we did go through a lot, and black people were experimented on quite a bit, and the knowledge of these experiments were put in journals that we were denied access to for the longest. So these things were actively being written on, and so then like it shows like throughout the history how they kind of like tweaked it, and instead of referring specifically to African American or blacks, because it was black or Negroes back then, they would like change wording, but it was still experiments done on the health and well-being of blacks. But she also points out in there too about different studies that they've done on like more recent day attitudes and beliefs that even medical students have. It was one study in particular where they were looking at the beliefs towards black people, and like literally I think it was like a couple of hundred medical students, but what they ended up finding was that they still held on to black myths about ones about how black people don't experience pain, um, like other people, black people heal quicker, and like these are medical students who were actively in a program, and they had these myths and stigmas in their mind going in to a doctor program or while pursuing their medical programs. And so like all of that still carries on, and even to this day like there's still certain medical equipments that have black settings
Mm-hmm.
and
Mm.
everything. Even when it comes to like it's one in particular, and I'm so mad that it's escaping me. It's a lung device for your lungs that tests something. But anyway, there's like still a black folk setting to where like they believe that black people's lungs couldn't expand or whatever like a white person would. Like we had lowered lung capacity and shit like that. And those tools and instruments still exist to this day. So it's like, yeah, things have gotten better, but once again, we do still have work to do. But it's important to know where we came from because a lot of where we came from is still circulating around right now. It's just not as obvious or evident. But if you know it, you can once again make better and more informed decisions on your own care, what healthcare providers you interact with, and things like that. Evolutionary process, but this is how we set it up for those generations that come behind us, though, is because we're making these types of moves and we're addressing these types of things right now in our present moment. So that way, the 7 generations that come behind us can do much better for the whole.
Yeah.
Thank you for that extra information. I love that. That was really
Love it.
good. I like
Before you stop the recording, I just want to make sure I think I said them right. But the U.S. mortality, maternal mortality is 17%. African American is 37%.
Mm.
Whites are 14%, and Hispanic is 11. So
Wow.
maternal. I knew it was very close to the numbers I said. So,
yeah.
yeah.
Wow.
That's a huge jump. That is what
Mm-hmm.
they call the disparity for real. Like that
Yeah,
Exactly.
huge.
Exactly.
and that's what people need to know, man. Like these numbers are outrageous. Like
Yeah.
Honestly, I'm in medicine, and I did not know it was that high for African Americans. Like I knew, it was disparity, but I didn't know it was 37%.
Good gracious.
That hit
Like we're
mhm.
on this call. Like if you take one of us off, one of us gonna die during childbirth.
Yeah.
That's
yeah.
uh, alerting.
Yeah.
Wow.
Like
And
that is
that's why it's so important for us to like be having these talks and working towards these health
Yeah.
equities, because man, we're getting taken out in so many different
Every which
ways.
way,
right.
everywhere, everywhere you turn, we're the target. You know.
Yeah. Yeah,
Um,
that's huge. I've heard of the rate, and I knew that it was big, and I knew that it was a care and a concern of public health. But to just hear 37%, it hits a lot different, because that is, that is huge. That's us and like another person on the call. You know what I mean? Or even thinking about, even if we don't die, something that could help with our health. I know I've probably told some of y'all the story, but when I went to go get my IUD at a one of the health clinics, they didn't even have an ibuprofen to give me. Like, there was a
what?
white, yes, it was a white nurse practitioner, and I got nothing. Like, it was just straight up. Have never been pregnant. I've never had any crank things in me. So it was just straight up like, I'm gonna give you this IUD in your uterus, and ain't nothing ever been there before. And I was just like, I think I was blacking out on the way home, literally from pain. And it was just like, they didn't even give me an ibuprofen. Like, literally, she was just like, "Oh, we don't have an ibuprofen here at the whole medical facility."
That's a
Whole,
problem.
and it was
Oh
just like,
no, they had.
yeah, they were just like, "Oh, you can go home." I'm literally sweating and blacking out as I'm paying at the checkout, and just drove home
Mm.
like I was in so much pain when I got home. I just laid down and went to sleep because I couldn't even walk around to find ibuprofen, to find anything for myself, And she was just like,
They didn't have any for you.
she gave me I said, "Can I have some water?" And she gave me one of those 8-ounce mini bottles of water.
She just didn't care.
Obviously,
That's
yeah.
why representation matters, because had we had one, I ain't gonna sit and say one of us, but we had someone who could relate more so than than not, that you would have been taken care of, I believe. So, 'cause like Dr. Roach said, they probably had some medicine back there. They just didn't have it for you,
Yeah, and they were like, "Oh, they
because you're
didn't
not
tell you to take
all
any."
of that.
Yeah, they didn't tell you to take any before you came here. No, didn't know that
No.
was the thing. And then that even makes me think about people coming into the medical field, just having this true knowledge. Because if you only go into it with the knowledge that they're telling you on the books, then that you don't have enough. Because I've gone into, again, medical facilities. I think I went to an urgent care once, and when I say that black male doctor could have cared nothing about my existence, I mean, it was just
Mm.
and I went and got an IUD without pain medicine. It was more of a worse experience with him because of just the blatant disregard of my existence. Like, me trying to ask questions. It's like, "Oh, we don't do that here. What do you want?" "Okay, well, we can just get you $150 back." Like, just trying to shoot me out without asking follow questions. Didn't take blood pressure. Didn't put his finger on my,
Ah,
nothing. And I'm like, if even though we're hoping for us to have more black doctors and do those things, but we do need to have some of this historical context being wrapped up in it, and not, like Dr. Roach said, just not having this little seminar so we can check off a thing that says, "Hey, we did an anti-racism seminar," but truly talking about this historical context. What does it look like when these people show up in this room? Because they might be bringing some baggage, and you need to be aware that you are truly bringing baggage into this room when you're interacting with this person. Are you seeing them as a person, or are you seeing them as some historical whatever that's going on with you on the inside? So,
right,
yeah.
right.
And everybody on this call is educated. Like, think about the sixth grade background for Kiki. Like, and she
Right,
goes
right.
into there and just think about how they get treated.
Yes.
I'm
Yeah.
not saying everybody is bad. I'm just saying.
Right.
But I
Yeah.
mean, I love that you said that, because even when I show up in spaces and if they don't know I have education, if they don't see a comma, all they see is some fat black girl with green hair. You know what I mean? They're not really looking like, "Oh, this could be somebody that's working on this or whatever." Like, you're not showing up as that. I'm showing up as a green hair girl in dress in Atlanta, in some yoga pants and some sandals. So I definitely get treated in a certain way when I go places, because I'm not presenting
Mm-hmm.
with my education or whatever it is that will make them treat me better. I noticed that completely, that people they'll treat me a certain way, and then if they ask me a question to further on and they find out, they completely treat me different. And I think this is absurd. If I wasn't able to transition, if I only had, like you said, that high school education or below, how would you treat me? How would you engage me? And would I even know that you shouldn't be treating me this way? Where's I might not have the
Yep.
language to even come in and ask some questions, or know that I, deserve better services than what they did.
Yeah.
That's funny. That's actually what I do. Like, I go to the doctor's office in sweatpants and a t-shirt. And it, like, now they've learned me because I've been here long enough. But like, they treat me the exact same way. Well, I have my hair out now, I'm perm, but I have crochets, and they just treat you like somebody else. And then, excuse me, and then they start apologizing. They're like, "Wait, you're one of our doctors?" Like, "Oh my god, But I do that. Like I go around town sweatpants and a t-shirt because and I've even had different providers tell me like, "Oh, you're not dressed like a doctor. Like, how am I supposed to be dressed?" Like like any other patient you would treat. So we all get it. And
Yeah.
I tell students I'm working with and everything like I do that because I don't go in the room. I want you to treat me like you were going to treat me because that's going to tell me how you are as a person.
That's true. Exactly. I've
Yes.
gotten plenty of people together
Right.
for doing that, and then they find out who I am. Like, no, treat me how. No, you don't treat anybody like this.
Right.
You know what I mean? But yeah, and when I go to the doctor's office and I answer certain questions a certain way, a lot of them I do see a lot of shock on their face. Like, oh, you know that, or like that's like what you expect. This is my body. I need to know my body. You know.
And I think too, a
But
big part of that is that medical model.
yeah.
It's the medical model doesn't truly focus on whole person health.
Yeah.
And so that's a whole nother soapbox for a whole nother day. But I think with that focus on that medical model, you're just sitting there, you're seeing that person's biology or whatever.
Yeah.
Like you're not seeing that this is a human being. They have feelings, they have thoughts. They may be different. Like you said earlier, I still love it. Teach me. A lot of the doctors are coming in with that teach me kind of thing, and it takes me back to like I remember going through my counseling internship for my master's, and I did my 10-month internship at a homeless shelter for families. And so there, day one, my clinical supervisor there wanted us to completely focus on relationship building. She didn't want us to go into like practicing different theories and techniques and stuff. She wanted us to build relationships. And that right there, it was definitely like the most valuable thing ever to have encouraged and invoked in me, because that's where a lot of us fall short these days, is because we're so stuck on, and of course once again this is colonial European education. So like but to focus on that relationship first, focusing on that human first, is where we've really gotten away from. And I remember one time I had slammed my finger in the door, and it needed to be put into a splint, and like they had to like relieve the pressure and stuff from my nail bed and everything. Well, he put the splint thingy on, then the doctor just left. It was a white male. But I was like, wait, what am I supposed to do now? Like, how long is this supposed to be on? Do I need to get it? Is it going to get wet? Does it not need to get wet? So I'm like, I go out and I'm standing in the middle of the hallway. Nobody's asking me any question. And I just kind of walk down a little bit looking for a doctor, looking for a nurse, looking for somebody. And like people would be flying by and I'd be like, excuse me, nobody would answer. So like I just had to walk down to the damn front desk and was like, hey, so I just got left in the room. What do I do with this? He just kind of left. And it was literally in the time, he spent more time on his computer typing than he did actually talking to me. And so that was a thing, and it to just up and leave me. I'm just like, what the fuck? Like,
Right.
So I felt like it was like a fast food doctor. You put in your order, come in, get your tea. You don't get no instructions or nothing. You pay or whatever, and then that's it. And so yeah, I just think that relationship.
Feel that one, fast food doctor though.
Yeah, man, that's exactly how I felt. I just was like, man. And then finally, I did see him, and he was like, "Oh yeah, you're gonna need to keep that on for about 2 or 3 weeks." Good to fucking know, because it was horrible too. Like it was the metal one, so my finger was just like stuck like this, and I was a waitress at Waffle House, so I'm sitting there having to fill out my tickets with my little splint finger and stuff. But but yeah, just like I think when it comes to these professionals, like we gotta take some steps back and get out of this medical model. We got to get back to these relationships and cultivating relationships with your patients or clients, whatever. And that goes for like not just the physical health field, but mental health as well. Because in my mental, I don't recall being taught nothing about like, yeah, we took like an ethics course. But it wasn't real cultural stuff. It wasn't. And when you get the degree, you get the license, and you get out there in the real world, you realize it's a lot different, a whole lot different. especially working in mental community mental health, where you're more likely to work with marginalized communities and things like that. But you're not taught that, and so I think just going forward as a society, we have to get back in touch with those relationships, with people's humanity,
Yeah.
in order to help alleviate a lot of these problems that we're having.
Yeah,
Yeah.
that's true.
I love that. Yes,
Yep.
definitely. It really makes me think more about even some of the past experiences I've had with doctors in many years when I was in undergrad. I had a cyst right here. I'm sure I still have the scar somewhere, and I had to go to an ophthalmologist so they couldn't, because they were scared it was going to cut into my eye. And it was almost like a 45-minute wait because the doctor was so confused that a black person had like mainstream insurance, that they talked to the doctor, they called the insurance company. I had to go wait in the office. They explained the insurance to me. They explained like what a copay was. And I was just like, yeah, I know all these things. I signed up for this appointment. I'm aware of all this. And they literally cut my face open, drained the cyst, and they didn't give a bandage or anything, and just was like, all right, like that was it. And so to me,
Wow.
that was one of my first experiences with a white doctor. And I was in South Georgia. I was in Valdosta, Georgia specifically. So I know that I was the only black person that had probably been to that doctor, because where's there any specialists in Valdosta that were seeing black people? I'm sure I mean, I was foreign in that office. Like everybody was so weirded out, like that I was there and was staring at me. And I just really didn't even get the concept, because coming from Atlanta, I've seen white people used to seeing us to a certain extent. And so being in Valdosta, where I was in that doctor's office, and they were just, I mean, it threw them off that I could be coming in because I had a lump on my face and I didn't want it there anymore.
Before we end this conversation, I really enjoyed it for one. Dr. Roach, what would you say, or what are some action steps that black women can take towards mental, physical, and womb health?
So, I guess first thing I would say is take care of yourself. So don't forget that in order for you to take care of other people, whether it's your parents, friends, your kids, you have to take care of yourself. So don't forget to go to the doctor. Now I'm not an adult doctor, I'm a pediatric doctor, but don't forget, mammograms start around 40 unless you have a history. Don't forget about colonoscopy at age of 45, 50, depending on, where you are in the country and your race. And just don't forget about your general health. I know I'm saying more towards females, but males too. Prostate cancer is very high in African American community. So just don't forget about taking care of those key things, going to the doctor, because unfortunately, we're discovering that preventive health is important. So we're discovering stuff in the African American community later, and that's why we are having worse outcomes, because we're coming in and it's already stage 3 or stage 4, and then there's not much you can do about it. So don't forget about taking care of yourself, going to the doctor, finding a local doctor. There are plenty of just going to Google and finding a local physician. There are more and more websites being built for finding like African American physicians and stuff like that. I was on a listserv. I don't know if it's actually been made, official, but there are people out there trying to make a change so that people will have access to finding that. But whatever specialty you look for, don't forget you can always go to that website. So like for kids, American Academy of Pediatrics, we look for a family medicine doctor, American Academy of Family Physician, and you can actually go look up that, and you should be able to find their bio, and a lot of times their pictures and stuff. So looking up somebody before you going to see them, and just Google. All of our stuff is public as far as our information. So just Google, kind of take a look and see what you're going to see. There's no need to go in 2021 blindsided. So
Right.
that's one thing I would encourage everybody to do. Just take care of themselves.
Well, Cheryl, thank you, and I appreciate you for coming and speaking with us. You guys may not know I've known Dr. Roach since 2005, 2006-ish, and so she's more like a family versus friends. And sorry about my dog in the background.
He just, he's hype about it.
Right.
She want to go to the doctor too to be healthy. But yeah, so yeah, you're more like a family, like we've already coined the term, because we're friends and family from the same place, in the same school, the North Carolina Central University. Enough of that. But yeah, again, thank you again for coming and speaking with us about Black health and trying to encourage everyone to break the generational curse and to be seen and take care of themselves. Anything you want to let people know or how to get in contact with
I
you? Do
do.
you have a YouTube
So it's
channel or any
basically
of
just my
that?
name, Cierra Roach. I know they'll have it written down there, but that's my YouTube channel. I just started it this year. Well, I guess the end of last year. As I was creating kind of a study guide website. So and that's CC Ball Creation. They have all the information that they'll give to you guys. I'm accepting new patients here in Danville, Virginia. So if anybody's looking for a pediatrician, and you're close to Danville, Virginia, we take everything. We don't do North Carolina Medicaid, even though we're like 2 miles from North Carolina. But the states don't communicate, so we can't take North Carolina Medicaid. But anything else you have, we'll more than happy to see you guys. And then I gotta throw in a plug because I'm opening a selfie museum. Hopefully in the next month or two. So come check it out. Forever in Danville, Virginia. It's Inspiring Mind Snapshot. So we're in the process of moving to a new location. So I don't have a address for you right now, but the website should go live the end of this month. So
Okay.
Awesome.
Good job. I'm looking forward to that.
yeah.
I know. So again, everyone, if you like what you heard today, like, share, subscribe, hit the bell, and Dr. Roach, you are welcome back anytime. Okay.
Yeah.